If you have been told that your knee pain is just arthritis and there is nothing you can do about it except manage it, take medication, or eventually get a replacement, I need you to listen to me very carefully. Because in the next few minutes, I'm going to show you 5 hidden causes of knee pain after 60 that have absolutely nothing to do with arthritis, that almost no doctor checks for in a standard visit, and that are almost entirely fixable without surgery, without injections, and without a single prescription. Approximately 25% of adults over the age of 45 in the United States report frequent knee pain, making it one of the leading causes of disability in older adults. And the overwhelming majority of them receive the same diagnosis: arthritis, wear and tear, your cartilage is thinning. That is just what happens with age. Here is the problem with that diagnosis. Research has shown repeatedly that the degree of cartilage damage visible on an X-ray or MRI often does not match the degree of pain the person is experiencing. There are people walking around with severely damaged cartilage who have no pain at all. And there are people with relatively healthy joints who are in agony every time they climb a stair. If arthritis were the whole story, that paradox would not exist. But it does, which means something else is going on. I am Dr. William Carter, and today I am going to walk you through the 5 real causes of knee pain that arthritis is getting the blame for. These are the causes that sit above, below, and around the joint itself, invisible on most scans, rarely discussed in a 15-minute appointment, and almost always treatable once you know they are there. The 5th cause, the one I am saving for last, is the one most people find hardest to believe, because it is not in your knee at all. It is in your hip. And the research connecting it to knee pain has changed how modern physical therapists approach the problem entirely. I want to say something important before we start. I am not telling you that arthritis is not real. Cartilage does wear down. Joints do change with age. But here is what most people are never told. Arthritis is almost always accompanied by several other problems: muscle weakness, tightness, inflammation, and alignment issues. And in many cases, those accompanying problems are causing more of the pain than the arthritis itself. Fix those problems, and the pain that was blamed entirely on arthritis often drops dramatically. That is not theory. That is what the research shows, and it is what I see in clinical practice every single day. Everything I share today is general health education. It is not a diagnosis, and it is not medical advice. If you have severe or worsening knee pain, please see your doctor. The studies I reference are linked in the description. Before we begin, tell me in the comments, how old are you, and where exactly does your knee hurt? Front, back, inside, outside? Your answer will help me understand what this community is dealing with. I read every comment. Now, let us get into it. Cause number 1, quadriceps weakness. The first and most common hidden cause of knee pain after 60 is weakness in the quadriceps, the large muscle group on the front of your thigh. And what makes this cause so insidious is that you can have significant quadriceps weakness without ever realizing it, because it develops so gradually that your brain simply adjusts to the new normal. Here is the biology. Your quadriceps muscle is the primary shock absorber for your knee joint. Every time you take a step, climb a stair, stand up from a chair, or lower yourself to sit down, your quadriceps contracts to control the movement and absorb the impact that would otherwise go directly into the joint. When that muscle is strong, it handles the load and the knee is protected. When that muscle weakens, which it does progressively after 60 due to sarcopenia, the age-related loss of muscle mass, the load transfers directly into the cartilage, the meniscus, and the bone. The knee is now absorbing forces it was never designed to handle alone. Think of it like the suspension on a car. When the suspension is working, the road bumps are absorbed before they reach the frame. When the suspension fails, every bump goes straight into the body of the car. Your quadriceps is your knee's suspension system, and after 60, it is almost certainly weaker than it needs to be. Research has established that quadriceps weakness is not just a consequence of knee problems, it is a predictor. Studies show that people with weak quadriceps are significantly more likely to develop knee pain and functional disability over time, even in the absence of significant arthritis on imaging. The muscle is the first line of defense, and when it fails, everything downstream suffers. Here is the part that matters most. Quadriceps weakness is completely reversible with targeted strengthening, even in adults well into their 70s and 80s. A systematic review of randomized trials found that quadriceps strengthening programs produced statistically significant and clinically meaningful reductions in knee pain, regardless of whether the exercises were general or targeted. The muscle does not care how old you are. It responds to load. It gets stronger when you use it. And when it gets stronger, the knee pain it was causing begins to fade. Simple exercises like wall sits, seated leg extensions, and step-ups are enough to begin rebuilding quadriceps strength. The key is consistency, 3 to 4 times per week, progressively increasing the challenge over time. This is not physical therapy as punishment. This is giving your knee back the protection it lost, and the research is emphatic. Even adults in their 80s show measurable strength gains when they train their quadriceps consistently. The muscle does not have an age limit, it has a use limit. If you use it, it grows. If you do not, it shrinks. And right now, if your knees hurt and you have been avoiding movement because of the pain, your quadriceps are almost certainly in a weakened state that is making the problem worse. The counterintuitive truth is that the right kind of movement, gentle and progressive, is what breaks the cycle. But quadriceps weakness is only cause number 1. The second cause is hiding right behind it, literally. Cause number 2, tight and shortened hamstrings. The second cause is tightness in the hamstrings, the muscles on the back of your thigh. And this one catches people off guard because tight hamstrings do not feel like they have anything to do with the knee. But they do. When your hamstrings are chronically tight, which is extremely common in adults over 60 who spend significant time sitting, they pull on the back of the knee joint constantly. This creates a compressive force across the joint that increases pressure on the cartilage, restricts full extension of the knee, and alters your walking pattern in subtle ways that put additional stress on structures that are not designed to handle it. You may feel the pain in the front of your knee, behind the kneecap, but the cause is actually pulling from behind. Here is the self-test. Lie on your back and raise one leg straight up toward the ceiling without bending the knee. If you cannot reach 80 to 90 degrees without significant tightness or pain behind the thigh, your hamstrings are likely contributing to your knee problem. Most people over 60 cannot reach anywhere close to that range, and the surprising part is that they had no idea the tightness was there until they tested it. Gentle daily hamstring stretching, held for 30 to 60 seconds per side, can meaningfully reduce this compressive force within 2 to 3 weeks. The key word is gentle. Aggressive bouncing or forcing the stretch does more harm than good. Slow, sustained holds allow the muscle to gradually lengthen without triggering a protective contraction. You can do this lying on your back with a towel looped around your foot, or seated on the edge of a chair with one leg extended and your toes pointed upward. Either way, you should feel a comfortable pull, not pain, along the back of the thigh. Here is something that surprises most people. Tight hamstrings and weak quadriceps almost always appear together. They are two sides of the same problem. The hamstrings tighten partly because the quadriceps are too weak to counterbalance them. This means that stretching alone, without strengthening the quadriceps, usually produces only temporary relief. The tightness comes back because the underlying imbalance is still there. The real fix is both. Stretch what is tight and strengthen what is weak. Together, they begin to rebalance the forces around the knee. But muscle and flexibility are only two pieces. The third cause is not mechanical at all. It is chemical, and it is flowing through your bloodstream right now. Cause number 3, inflammation from diet, not from arthritis. The third cause is systemic inflammation driven by what you eat, not by structural damage inside the knee. And this distinction is critical because it changes the entire approach to treatment. Most people assume that knee inflammation means something is physically damaged inside the joint. Torn cartilage, bone rubbing on bone, arthritis flaring up. But research published in 2022 confirmed that pro-inflammatory diets are independently associated with joint pain, and that chronic systemic inflammation can drive knee pain even in the absence of significant structural damage. In other words, your knee can be inflamed and painful not because of what is happening inside it, but because of what is happening in your bloodstream. The foods that drive this kind of inflammation are the usual suspects: refined sugar, processed seed oils, excessive refined carbohydrates, processed meats, and excess alcohol. These foods elevate inflammatory markers like C-reactive protein and interleukin-6, the same markers we discussed in our artery health video, and those markers circulate through every joint in your body, including your knees. Your bloodstream does not send inflammation only to one place. It goes everywhere. And joints, particularly weight-bearing joints like the knee, are among the most sensitive recipients. Here is the hopeful part. When people reduce or eliminate the most inflammatory foods from their diet and replace them with anti-inflammatory options like fatty fish, olive oil, leafy greens, berries, and turmeric, many experience a noticeable reduction in joint pain within 4 to 6 weeks. Not because the cartilage regenerated, not because the arthritis disappeared, but because the fire of systemic inflammation, the fire that was making everything feel worse than it structurally was, burned down. I have seen this pattern so many times in my career that I now consider dietary assessment essential for any patient with unexplained or disproportionate knee pain. Your doctor may not connect your diet to your knee pain because the standard orthopedic evaluation does not include a dietary assessment. But the research is clear. What you eat either fuels or fights the inflammation in your joints. And for many people over 60, dietary inflammation is a larger contributor to knee pain than the arthritis showing up on their X-ray. Think of it this way. If your knee was a house, arthritis is wear on the foundation. But dietary inflammation is a fire in the walls. You can reinforce the foundation all you want, but if the fire keeps burning, the house keeps hurting. If this is already shifting how you think about your knee pain, take 1 second and tap the like button. And stay with me, because cause number 4 is one that most people have never heard of, and cause number 5, the hip connection, is the one that changes everything. Cause number 4, the iliotibial band. The fourth cause is tightness in a structure called the iliotibial band, or IT band. This is a thick band of connective tissue that runs along the outside of your thigh, from the hip all the way down to just below the knee. When the IT band becomes tight, which it commonly does in older adults due to muscle imbalances and prolonged sitting, it pulls on the outside of the knee joint and creates a sharp, burning pain that is often mistaken for arthritis. IT band-related knee pain tends to be worse when walking downhill or downstairs, when standing for long periods, or when transitioning from sitting to standing. It is frequently felt on the outer edge of the knee, and it is one of the most commonly misdiagnosed sources of knee pain in adults over 60, because it does not show up on an X-ray. An X-ray shows bone and cartilage. The IT band is soft tissue. It is invisible on standard imaging, so it gets overlooked while arthritis, which is visible, gets the blame. Here is a simple way to check if your IT band is contributing to your pain. Stand on your affected leg and let your pelvis drop slightly on the opposite side, like you are shifting your weight onto one hip. If this immediately increases your outer knee pain, your IT band is likely involved. Another indicator is if you feel a snapping or clicking sensation on the outside of your knee when you bend and straighten it. That snap is the tight IT band flicking over the bony prominence on the outside of your knee joint. Foam rolling the outside of the thigh, combined with targeted stretching of the hip flexors and gluteal muscles, can significantly reduce IT band tension within a few weeks. But here is the important insight. The IT band is actually a symptom of a deeper problem, not the problem itself. The IT band tightens because the muscles controlling it, specifically the gluteal muscles of the hip, are too weak to do their job. And that deeper problem is cause number 5, the one I told you about at the very beginning, the one that is not in your knee at all. Cause number 5. Hip muscle weakness. The fifth and most important hidden cause of knee pain after 60 is weakness in the muscles of your hip, specifically the hip abductors and the hip external rotators. And this finding has fundamentally changed how physical therapists and sports medicine researchers approach knee pain in older adults. Here is why this cause is missed so often. When you go to a doctor for knee pain, the examination focuses on the knee. The doctor presses on the joint, moves it through its range of motion, and orders an X-ray of the knee. Nobody examines the hip. Nobody tests hip strength. Nobody looks at how you walk and asks whether your thigh is rotating inward with each step. The knee is the symptom, so the knee gets all the attention. But the emerging body of research over the past decade has made one thing overwhelmingly clear. For many people, the knee is not where the problem lives. It is simply where the problem is felt. Here is the biomechanics. Your hip muscles control the alignment of your entire lower leg. When your hip abductors, the muscles on the outside of your hip that prevent your leg from collapsing inward, are weak, your thigh rotates inward with every step. When your thigh rotates inward, it changes the angle at which your kneecap tracks across the joint. Instead of gliding smoothly in its groove, the kneecap gets pulled laterally, creating friction, pressure, and pain in the front of the knee. This is called patellofemoral pain syndrome, and it is one of the most common causes of anterior knee pain in both young athletes and older adults. Biomechanical studies have confirmed that people with this type of knee pain consistently demonstrate excessive hip internal rotation, excessive hip adduction, meaning the knee drifts inward, and measurable weakness in their hip abductors and external rotators compared to pain-free individuals. The knee is the victim, the hip is the criminal. And treating the knee without addressing the hip is like changing the tires on a car with a bent axle. The tires will keep wearing out until you fix the axle. This is why so many people go through rounds of physical therapy, focused only on the knee, and get temporary relief that never lasts. The pain returns because the source was never addressed. The source is higher up. A 2018 systematic review concluded that hip strengthening combined with knee-focused exercises was significantly more effective at reducing knee pain than knee exercises alone. The addition of hip strengthening produced better outcomes in pain reduction, functional improvement, and long-term maintenance. The hips are not optional, they are the foundation. The exercises that strengthen these muscles are simple. Side-lying leg lifts, clamshells with a resistance band, and single-leg mini-squats are among the most effective. 2 to 3 sets of 10 to 15 repetitions, 3 to 4 times per week, is enough to begin restoring hip control. Most people feel a difference in their knee pain within 3 to 4 weeks of consistent hip training. That is not a coincidence. That is the knee finally getting the support it was designed to receive from above. And here is what makes this finding so powerful. Unlike cartilage, which regenerates slowly if at all, muscles respond to training within weeks. Unlike anti-inflammatory medications, which mask pain without addressing the cause, hip strengthening fixes the mechanical problem that is generating the pain in the first place. And unlike surgery, which carries risk and recovery time, these exercises can be done in your living room with a resistance band that costs less than a bottle of ibuprofen. The solution has been available the entire time. It was just looking in the wrong place. Here are all 5 causes one more time, and I want you to screenshot this. Cause 1. Quadriceps weakness. Your knee's shock absorber has failed. Cause 2. Tight hamstrings pulling the joint out of balance from behind. Cause 3. Dietary inflammation making everything hurt more than it structurally should. Cause 4. A tight IT band creating pain on the outside of the knee that X-rays cannot see. Cause 5. Weak hip muscles destroying knee alignment from above. Not one of these causes is arthritis. Not one of them shows up on a standard X-ray, and every single one of them is fixable. I am not telling you that arthritis does not exist or that cartilage damage does not matter. It does. But for millions of people over 60, arthritis is getting blamed for pain that is actually being driven by the 5 causes I just described. And the difference between those 2 explanations is the difference between a sentence and a solution. One tells you to manage your pain and accept the decline. The other tells you to fix what is actually broken, to strengthen what is weak, to stretch what is tight, to clean up what is inflamed, and to restore the alignment that your knee was designed to operate within. If I could give you one action plan right now, it would be this. 3 to 4 times per week, do the following. 5 minutes of hamstring stretching, 5 minutes of quadriceps strengthening, wall sits or seated leg extensions, 5 minutes of hip strengthening, side-lying leg lifts and clamshells. That is 15 minutes 3 times per week. Within 4 weeks, most people feel a meaningful difference. That is not a guess. That is what the systematic reviews consistently show. 15 minutes, 4 weeks, a knee that moves differently. Tell me in the comments which of these 5 causes you think might be driving your knee pain. Tell me your age. Tell me how long you have been dealing with it. I read every single comment, and your story might help someone else realize that they do not have to accept knee pain as permanent. If you are not yet subscribed, do it right now. Every week I bring you evidence-based health information designed specifically for adults over 60 who refuse to accept that pain and decline are just part of the deal. They are not. They never were. Share this video with someone who has been told their knee pain is just arthritis, because what they were told might be wrong, and what they need might be simpler than they ever imagined. Until next time, move well, strengthen what is weak, and never let a diagnosis become a dead end.